For more than 2 years, our lives have been changed by a worldwide pandemic. Now, U.S. officials are suggesting a big surge of COVID-19 could infect 100 million Americans this coming fall and winter. That's hard news to hear, but it's not surprising for people who've studied the 1918 flu pandemic. Experts just published an article comparing that outbreak to our current pandemic to answer a critical question.
Which is, how do pandemics end? Do they ever end? And what are the aftermath or aftermaths of a pandemic? Can we see that historically? What might we be able to expect, or what kinds of questions should we be asking ourselves?
Christopher McKnight Nichols is the director of OSU's Center for Humanities and a history professor. He, along with other experts, see many similarities between the influenza pandemic of the past and our current COVID crisis. First, that both diseases will very likely live on and take lives.
So, short answer is no, pandemic isn't over. And the long answer is the same thing with the flu. The flu's still with us, right? 100 plus years later. COVID will probably still be with us in 100 years.
Nichols knows that after 2+ years, COVID fatigue is real and understandable. But he is concerned that, like in the early 1900s, people ignoring the facts and deciding it's over will make us less safe.
So one of the things you see in the historical record is mayors and public health officials hoping the pandemic is over and yanking off measures, even when they didn't have vaccines and other things. And then you have much higher surges, a second peak that's worse.
Some of the methods of fighting disease haven't changed much. In 1918, they used quarantines, similar hygiene practices, and what we call social distancing today. But there are differences between now and then, when efforts to develop effective vaccines did not work. That's not the case today. Modern medicine and public health infrastructure is much better. But Nichols says the science still isn't the final decider.
From my perspective as a historian, the ending of a pandemic is political or psychological. It isn't biological or epidemiological. And that's something that we could get across to people almost regardless of their politics.
So learning from the past is, in essence, realizing it's up to us to responsibly deal with a disease that will be with us at some level for a very long time.
We need to figure out how to take on board those lessons and make better judgments moving forward, which may mean restricting our lives a bit. And I think we need to be comfortable with that.
Tim Gordon, KGW News.